Hello, welcome to the first of 3 video tutorials designed to help nursing students at Bushnell University to quickly develop effective search queries for researching evidence-based practices. Evidence-based practice is the process used to review, analyze, and translate the latest scientific evidence. The goal is to quickly incorporate the best available research, along with clinical experience and patient preference, into clinical practice so nurses can make informed patient care decisions. In this session, we will explore the first building block in the clinical research process, known as the PICO question. PICO is a thinking tool to assist us in developing questions that can be converted into effective research database queries. PICO is an acronym designed to help us remember the 4 elements that every well-designed clinical question must have. P is for the patient problem or population we are working with. I is for the intervention. In other words, what are we going to do with this patient? Or how are we planning to treat this problem or work with this population? C is for comparison. We must compare our intervention with something else in order to demonstrate that it is better. And O is for our anticipated outcome. What do we think will happen because of our intervention? Let's look at how we might develop a good question into a well-designed PICO question. Let's use as an example why people get sepsis in hospitals. Some initial questions that might come to mind include what causes sepsis in the first place? Could there be a specific hospital practice to blame? Should sick people just avoid hospitals? While all of these are questions, they do not have all 4 of the required elements of a PICO question that are in the chart on the right. In the next few slides, we will make this question into a PICO question. Now, what are some of the hospital practices that might be worth looking into? How healthcare workers wash their hands, equipment care, medication distribution, or disposal practices. Let's explore the hand washing practices of healthcare workers. To develop a PICO question about healthcare worker hand washing practices, we must identify the 4 elements in our query. In this case, we are going to look at the population of healthcare workers. The intervention or action we are going to expose them to is hand washing. For comparison, we might use any standard method that is recommended or mandated by a health organization. And of course, the outcome we want to see is a low rate of infections in hospitals. Here is a way to state this as a PICO question with all 4 required elements. Will soap and water, compared with other methods of hand washing among healthcare workers, result in fewer cases of sepsis? Soap and water is our comparison term. Hand washing is our intervention. Our population is healthcare workers. And our result, our outcome, is to hopefully have fewer cases of sepsis. Now think about a topic that you want to research. Each of these 4 required elements will be necessary to make it into a researchable PICO question. Now that we have a PICO question with the 4 required elements, we need to be sure to include each of these 4 elements into the database search in order to get the results that we can confidently use to guide our clinical-based evidence practice. This means coming up with keywords and other effective search terms. In the next tutorial, turning the PICO question into keywords, we will practice developing effective search terms for efficient database searching.